we're going to talk about a very interesting and exciting topic, facelift surgery. I think it's probably one of the second most common surgeries next to liposuction that is performed in the United States. And there are a variety of types of facelifts that can be done. And most people are coming in for them for, sagging skin, loss of facial volume, and there's different ways that they can be approached. So we're going to just go through the panel here and discuss how most people like to approach them, from a standard facelift to a mini facelift to a micro facelift, and what is the definition. And we're going to specifically speak about mini facelifts. So Jonathan, why don't you go ahead?
Yeah, sure. So I think the concept of a mini anything in plastic surgery is designed to meet a patient need where they want something that seems less invasive, less downtime, but still has the same power to achieve a result that is worth their time and money. So a mini facelift is a compromise by definition. I don't do a lot of mini facelifts. When I have, they've kind of been skin only. And I think that for me, the definition of mini facelift relates to the size and extent of the incision and undermining.
Great. And Julie, what about you? What's your opinion of a mini facelift, and do you do a lot of them in your practice? Or?
We do. I do a fair amount. I think that it's a good tool to have in your toolbox for a patient that doesn't want to have, the massive downtime. They don't want to have a big scar, that maybe they just need a little tweaking and not a full dissection.
And how about you, Kristen?
Yeah, no, I'm not a
ideas?
major fan of mini facelifts. I think there are so many non-invasive or minimally invasive options now that have kind of replaced the mini facelift in my practice. So I'm doing a lot more of those bridge procedures, facial fat grafting, so filling some volume in some deep planes, and doing a lot more kind of resurfacing, maybe some microneedling things. So I think I'm doing many more bridges for those in-betweeners that a mini facelift may have worked for, and then when they're just ready to go full throttle, I'm right there with them. So I'm not a major fan of the mini facelifts, but I do know in the right hands and the right patient, it's a good option. I remember I had a gal come from Brazil, and she was 35, and she said, "Okay, I'm ready for my first facelift." And I was like, "What? You're beautiful. You have nothing." She goes, "No, that's culturally, that's when they started." So, I think there is probably a market for that. I haven't quite jumped on the bandwagon as well, but I applaud my colleagues who certainly have, yeah.
So I'd like to just address, when a person comes in for, say, some facial rejuvenation, when would you decide to do a mini facelift versus doing a standard full facelift or micro lift or that? I mean, what are your parameters, Jonathan?
So you have to match the procedure to the indication. If you have somebody who has a lot of jowling, a lot of tissue descent, that's not somebody who's going to be fixed by a mini anything. You've got to get in there and fully reposition the tissues. I think it's an interesting, question to piggyback on what you said, to match a mini facelift with someone who has less of a surgical need, maybe a younger patient, someone who would traditionally be in the pre-facelift crowd, almost sort of like setting the expectation low given the surgical accomplishment you can get.
And what about men? Has anybody had experience with men requesting mini facelifts? Because usually I've found in my own practice that men usually don't want the big surgery. They might want to do something, but they want a littler
Are you
surgery.
saying men are wusses?
No, I'm not saying men are wusses. Are you a wuss?
It just sounded, we went less. I think in general men are a little bit wusses.
Well, I think too that there's, this scare of looking different, right? One, the scar patterns, right? So we do change the way we put scars on those patients. We're not hiding them in hairlines to the same way we might in a female, for example. And so I do think there is some nuances and just kind of that, underdone versus overdone look. I think a lot of our men just have a different aesthetic. They don't necessarily want to be pulled as tight as maybe some of our women do, and I think they want a little bit more of that natural appearance. And so maybe that's where that comes into play, certainly, is kind of those mini kind of procedures. They maybe don't want to go full throttle because they're worried they're going to look so different. And to some degree, I share some of their worry, right? Because that can easily go astray, certainly.
There's an anatomic consideration too. I mean,
Yeah.
When you reposition tissues to achieve a woman's face, you want that kind of like high, full fat cheekbone.
Right.
For men, I
Absolutely.
think it's a
Inverted
lot
triangle.
more. Right. For men, what do you think? It's like
It's much more
about
square.
Yeah.
And also I think it's very appropriate for men to look a little shaggy. I don't mean like a dog shaggy, but I think, shagginess is more acceptable in a male. And, they don't.
For sure.
Yeah. That's my opinion anyway.
Yeah, it's a little more
Agreed.
masculine,
Yeah.
exactly.
Thank you, everybody. I thought that was a great panel, and thank you all for participating. For more information, go to theplasticsurgerychannel.com.